This is Dr. Calvin C. Chapman, commander of the 3rd Tactical Dispensary at Ben Hoi Air Base, Vietnam. I hope to describe to you the humanitarian medical programs that our medical personnel are carrying out in support of the Vietnamese people in hamlets and villages in the vicinity of Ben Hoi Air Base. We see an Air Force ambulance, popularly referred to as a cracker box, loading, ready for departure on a medical visit to the village of Mi Quoi in Vietnam. We drove about 1 mile from the air base to a dock along the Dong Nai River. We had 2 doctors, 4 medical technicians, and several other interested people from the air base participating in our medical village visit today. You'll notice that we carry footlockers, boxes of medical supplies and equipment on the dock down across an ammunition barge to an LCVM, Landing Craft Vehicle Medium, United States Navy Vintage World War II. The LCVM belongs to the Vietnamese River Patrol and is used to patrol the Dong Nai and other rivers. It carries 2 20-millimeter cannon and 150 caliber machine gun, and it's a very useful tool. For us, it serves as a means of transportation about 5 miles up the Dong Nai River to the island, and from the landing spot we go inland about 1/4 of a mile to Mi Quoi village. This is the Dong Nai, a lovely river influenced somewhat by the tides, but it is fresh water at this point. The small vessel with us is another Vietnamese river patrol boat. Here we see the 2 small escort boats tied up adjacent to the LCVM. And here we are offloading from the LCVM the medical supplies and equipment that we will use at Mi Quoi. It's about 10:30 in the morning at this particular time. The island is controlled by friendly people. However, there are VC on the island. Consequently, since there are VC in all of the territories in which we make our medical visits, we do have as much security as we can get. Up the steep bank we go, carrying the equipment, and eventually the equipment is loaded on Stone Age transportation. You'll see an ox cart, which turns out to be the most handy means of transporting things overland in this area. You'll notice in the ox cart our footlockers, boxes, and other things piled high. We also have a polystyrene cooler which carries ice and soft drinks. These are very pleasant to have during the heat of the day on our village sick calls. The thatched hut in the background is typical of the huts lived in by villagers in this area. You'll notice that things are very dry. These are sugarcane fields, and in this case the sugarcane has been harvested, taken to cane mills, and the juice has been extracted and boiled down into sugar. Here comes the ox cart plodding along, piled high with our materials. In the background is one of the tombs. Here we are in the village of Mi Quoi. Offloading the ox cart, we then proceed to set up using tables, chairs, etc., to have our sick call under the trees. The temperature is about 95 degrees during the dry season. The sun is very hot. Working in the shade is extremely pleasant because there is a soft breeze. Even though everyone perspires a great deal, it's better to be outside with high shade under these trees than it is to be inside with little or no air circulation. You'll notice we set up our footlockers containing the drugs, etc., on tables. And you'll see the villagers standing around waiting for us to commence sick call. And we are now getting underway. Dr. Chapman is about ready to examine a young fellow. This young fellow had pneumonia. You'll notice that he's very lethargic. He is very, very pale. And as I listened to his chest, I could hear clear indications of pneumonia. He was also extremely hot to the touch. A broad-spectrum antibiotic in liquid form was prescribed, and at last visit, this young fellow was doing extremely well. Ear problems are fairly common. You've all had children, I'm sure, with running ears. This young fellow's no different. He has an ear infection. We'll take a look at the throat. The kids are extremely cooperative. You'll notice that without any prompting at all, this young fellow holds his mouth wide open. As a matter of fact, it was 30 seconds before he finally closed his mouth. Dr. Chapman here is examining a man who had smallpox in his youth. You can see pockmarks on the face because of the severe scarring left by the disease. Here you see pockmarks on the arms and also on the chest. Many people do get smallpox in childhood over here, and approximately 20 or 30% of the people with smallpox die. This man obviously did not have smallpox now, but he did have a chest problem. He had bronchitis, and medication was prescribed for him. This lady, being seen by Dr. Edgar Koch of Sheboygan, Wisconsin, has leprosy, and it has severely affected her hands. If you will notice, her hands and her lap are very gnarled, and she cannot move her fingers at all. Her hands resemble bird claws. The leprosy has destroyed the nerves, and the muscles of her hands no longer work at all. Her fingers are contracted and fixed in position. We can provide medication to stop the leprosy from progressing any farther, but the damage that has been done can never be corrected. We found out that this lady has had this problem for almost 10 years, has never been seen by a doctor or received any treatment. Here, Dr. Chapman is seeing a Vietnamese gentleman who is in his 50s. You'll notice the black pajama top he wears, and he also wears a white cotton undergarment. You'll notice the man is extremely emaciated. You can see his ribs sticking out, you can see his muscles, and he's very, very thin. This man has had, for 2 years, severe cough. He has had pronounced weight loss. He has severe sweating at night, and occasionally he coughs up blood. These are classical signs of TB, and as I listened to his chest, it was quite obvious that he did have tuberculosis. Tuberculosis medication is being prescribed for him now. Now he's dressing, and the interpreter is writing on the label the proper dose for the medicine. Here's a young lady and a baby, very, very typical of patients we see. This young girl had no specific problems except vitamin deficiency and anemia. Vitamins and iron fixed her up in good shape. This is a typical example of a family. There are 4 children in this family. They were all treated, some for worms, some for vitamin deficiency, some for anemia. This young fellow has several little pill boxes and a couple of bottles of medicine. Here's an old gentleman, another fellow with tuberculosis. Again, notice the extreme weight loss. These people are all muscular. None of them are fat. This mouth is of interest because this man has only 1 or 2 teeth left. Dental hygiene is very poor. The children start chewing on sugar cane as soon as they are old enough to toddle into the fields. The older people chew betel nut. Consequently, because toothpaste and dentifrice are unknown, the teeth decay very rapidly, and many children have their teeth decayed by the time the baby teeth fall out, and when the permanent teeth come in, they never do get a chance to develop. This is Tech Sergeant Eugene Gonzalez, who is also acting as one of our doctors in our sick calls in the villages. Sergeant Gonzalez is excellent, and he can do just as fine a job as our doctors can working with the Vietnamese. The interpreter is explaining to the mother how to use the medication for this child. The child has severe skin rash, including boils and infected insect bites all over his head. And the interpreter is writing on the pill box and on the little plastic bottles the doses of the medicine. This young lady, again, was in reasonably good shape, and all she needed outside of a quick checkup was some vitamin pills. Here we are showing the mother how to use liquid vitamins for the infants. Just a fraction of a cubic centimeter in the mouth by dropper. every day will help the children. Here's a young fella who is just barely toddling around, and he's just as interested in watching our sick call as are the rest of the villagers. It's been a long day. We've seen Vietnamese for over 4 hours, and now we're back at the riverbank loading up the LCVM, ready to sail back downstream to Ben Hoi. We've seen over 300 patients, old folks, young folks, children, grandmothers, grandfathers, and so on. As we load up the boat ready to go home, we can reflect that it's been a wonderful day. We go out on 7 or 8 village visits every week. Sometimes we send out 2 teams in one afternoon. Sometimes we go by boat. Most frequently we go by ambulance over roads near the base. We go to 25 different locations, and we've been running our programs for 10 months. When I arrived in June of 1965, we started the programs, and we saw 200 people that month. In October, we saw 800. In December of 1965, we saw 1,500. In February of 66, 3,400. And in March of 66, 5,000. Been a very, very busy, very successful program. It's all voluntary. We do it in our spare time, and we enjoy the relations we have helping the Vietnamese people, which in turn helps the United States Air Force. This has been Dr. Calvin C. Chapman, commander of the 3rd Tactical Dispensary, Ben Hoi Air Base, Vietnam.